This is what happens when you eat a sandwich from anywhere made with white flour, refined, non-whole grain flour inside your stomach. This is exactly what happens in our stomachs. Look, the stomach has things sticking to its wall. It tries to squeeze and squeeze and squeeze, and the air is at the top. The liquid starts to rise and rise and rise. Where does it go? It reaches the esophagus. And what does it cause here? Acid reflux, GERD. The liquid keeps rising because the stomach below is squeezing and squeezing and squeezing the fluid. The fluid starts rising, pushing the air, reaching the esophagus, causing acid reflux. This stomach, it will start passing its food after about 3 to 4 hours. Look, see how it's sticking? See the colloidal glue-like substance dripping from it? See how your stomach wall hasn't been cleaned of this dough? Because it's glue. It's like glue. That's why the protein found here, what's it called? Gluten, glue-like. Look, it doesn't leave your stomach wall. It stays stuck to your stomach wall. This is how your stomach looks after it's supposedly empty. It hindered the contraction. It didn't let it contract properly. It caused reflux, and as it went down, it stuck to your stomach wall. But this is what happens in your stomach when you eat whole grain flour. Whole grain contains the wheat germ. It doesn't dissolve because it contains bran. It has a granular appearance. You always find it looking like small grains. The stomach keeps squeezing and squeezing and squeezing, but what happens? It just crumbles. It doesn't interfere with the contractions. So it's impossible to cause what? Impossible to cause reflux because the stomach's contractions always absorb it. Look, it never rises into your esophagus. It didn't cause reflux. When the stomach cleans itself of it, look how it cleans itself, just like that. And when it passes it out, we'll do the same thing we did before. The food leaves the stomach this way. Pieces, 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 no cohesion or sticking between them. The stomach finishes quickly. It passes its food and empties on time. No indigestion occurs. Look at this wall. And this wall. See which one is transparent? Who finished faster? Who passed their contents? Who left nothing inside the stomach with minimal effort? Look at this. This is your stomach wall after eating a shawarma sandwich or pizza. And this is your stomach wall after eating whole grain bread made from flour. The story begins here. Wheat. This is the wheat grain. We ground it and got whole grain flour. Then we used a centrifuge to remove the wheat germ and the husk, and we produced this, pure, refined white flour. This consists only of starch and gluten. We put the white flour in this bottle, assuming this is our esophagus and this is the stomach, and in the yellow one, we put the whole grain flour. So we'll call this whole grain, and this is the refined white flour that we eat in Al-Awady bread, fino bread, and all types of bread. Next, we add digestive juice to this one and the same juice to the other to make them both the same. And we simulate the stomach's movement as it tries to digest this food. The stomach muscles are very strong. Its original job is to be a meat grinder. As it grinds meat, it must grind all contents until they have this consistency, a foamy consistency. Easy, crumbled, made entirely of grains. Look, it's perfect. Now we take the same amount of water for this white flour that we eat every day. We try to dissolve it. After about 3 hours, the stomach tries to empty the contents it processed during digestion. So we empty this white flour bottle. Then we go to the whole grain flour in our stomach. Okay? We do this, it came out with total ease because it's grains. Some remains here on the wall and some here. What do? We add as much water as possible. Here is the water. We are trying to wash the stomach. We added water up to this mark. We will put the same amount in the second bottle to wash it. 508. The stomach pours more water to wash itself and continue its main job, grinding meat. Then we empty it. The bottle is almost completely clean. Now here, with the same amount of water, look, I'm even adding more than the first one, even more. And we pour it out to get rid of it. Look at the amount that is stuck. See how much is stuck. It didn't move and didn't dissolve. Look at this bottle. With the same amount of water, the bottle is clean. But look here. Look at the transparency that disappeared from the bottle. See its color? Look at the level of purity here versus here. This is a healthy stomach wall. This is an injured stomach wall. The white flour stuck to it and wouldn't leave the wall easily, even with the same amount of fluid. That's why the stomach needs the same amount of water again. In both stomachs, this for the whole grain and this for the white flour. The stomach is cleaning itself, trying to get everything out. The stomach is perfectly clean with the whole grain flour. But here, the stomach cleans and cleans and cleans with the same amount of fluid in both. And you will see both basins are filled with the same amount of water in the end. See what's left? See this stomach wall? Look at the color of this bottle and this bottle with the same amount of fluid. This one stayed stuck, and this one has nothing stuck to it. This one is transparent, pure. This is the stomach wall after a meal, and this is the stomach wall after eating white flour. I hope the difference is now clear to everyone. Before you complain about diabetes or obesity, your body gave you several warnings, and you should have taken them into account. I will count them for you, so you know your body warned you, and you either ignored it or not just ignored it, or you treated it in the wrong direction. Number one, acid reflux, GERD, the most famous disease in Egypt and the world. The symptoms are heartburn, a constant feeling of heaviness in your stomach after eating, indigestion, and acid reflux. You feel the acidity coming back up. This is the first warning your body gave you. The second warning, your body said you have irritable bowel syndrome, IBS. As long as there is IBS, you have malabsorption. Malabsorption means you aren't getting vitamins, carbs, fats, or proteins properly. The biggest proof is that later you complain about vitamin D. Mind you, vitamin D won't just drop on its own. If you get fatty liver, the maestro is damaged. The fats get trapped inside the liver instead of going to their natural places. Most importantly, the bones. So vitamin D drops again. Vitamin D helps form bones and teeth because it absorbs calcium from the small intestine, but it doesn't reach them. You see children complaining from a young age. They need dental care. Their teeth have cavities. They grow up and their molars break. They need root canals. By age 40, half their teeth are artificial, dentures, all artificial. They test their vitamin D, deficient. They get a bone scan, osteoporosis. Brittle, weak bones, no protein, no calcium. So you must know, before reaching the stage of obesity or diabetes, you suffered from all of this. And your liver must be fatty. How do you know? With just one test or an HD ultrasound. You do a scan on the abdomen. You will find a fatty liver, a bright liver. This is incredibly common in Egypt and Western society. What happens after we eat our shawarma sandwich or a piece of pizza? The food is chewed here in the mouth. After a while, it goes down the esophagus. Note, I drew the esophagus blue because it is alkaline. Then it reaches the end of the esophagus and enters the stomach. The stomach requires two things to work. It must be very strong. Its contractions must be very powerful. Contractions, because the food arrives barely digested. It also must have a very strong acid to kill bacteria. activate an enzyme called pepsin. Don't forget the name. It's like Pepsi. Pepsin is responsible for digesting the meat in your shawarma. It breaks down the collagen in it. So the food drops here, the stomach grinds it and grinds it. Acid pours over it from above like a fountain. It activates the pepsin to digest the meat inside the bread. The meat is here and the bread is on the outside. Then the acid tries to dissolve the bread on the outside to reach the meat inside, but it's sticky, stuck to the meat, stuck to the stomach wall. The stomach's contractions slow down. It can't. It tries to squeeze the food, but it can't. The food stands still and sticks to the stomach wall like this. The stomach starts pouring more liquid on top of it. The liquid level starts to rise. But the digestion problem still exists under the liquid. The fluid rises, water mixed with HCl, hydrochloric acid. With all that squeezing, the heavy stuff stays at the bottom, the meat and the bread. What rises to the top? The spices, the flavors, the taste. That is what rises. The stomach stays in this shape. The upper part holds the air. This starts acting like a bathtub overflow drain. That is exactly what happens here. This soup rises up, and this soup contains acid, yes, but less than what's at the bottom. The acid is very red, strong down here. But at the top, it's a soup where you can taste the spices, garlic, onion, and tomato sauce. That's why doctors tell you, stop eating fried food, because what's at the top is the soup. But the problem is at the bottom. The problem we saw with refined flour is that it stuck to the stomach wall. It didn't let it contract. It caused indigestion. The symptoms you feel immediately after eating pizza or shawarma, because the Syrian bread is made with refined flour, it sticks to your stomach wall. The stomach starts crying for help. It releases a simple juice with weak acid. This irritates the esophagus, so you start treating the problem here at the top. Common home remedies like Laban Rayeb, buttermilk, oranges, yogurt, or sometimes Pepsi or effervescence. Which is right and which is wrong? Laban Rayeb, milk, and yogurt are acidic, meaning they increase the acidity here, helping the stomach digest. Also, Laban Rayeb has a property. It tries to coat the stomach wall that was inflamed from all that sticking. It relieves you for about half an hour. Yogurt does this, citrus fruits do this, oranges, lemons, tangerines. These are weak acids, right? But they are acids that help penetrate and digest this mass. However, in the other case, when you take an effervescent or Pepsi, it's like taking sodium bicarbonate. What does that do? It neutralizes the acid, the acidity drops further, so the reflux increases. The reflux increased. So what's your next step? You take medicine that blocks HCl secretion. We all know these drugs, the ones ending in -loc, Antoloc, Pantoloc, Osmoloc. In their various doses, they stop HCl secretion entirely. But that means what? Your indigestion increases. Yes, it increases. But you won't feel the reflux. So it treated the symptom of reflux, the soup that irritated the esophagus, but by stopping the acidity and killing the acid, it removed our strong defense. This means bacteria appear, specifically H. pylori. As long as you are taking PPIs, proton pump inhibitors, it will never be cured. It will come and go, come and go. It will stay with you in a zigzag pattern. It will never disappear because your stomach acidity is lower than normal. Once you reduce the acidity, the reflux continues, indigestion stays, but you just don't feel the symptoms. Next step, no acid means bacteria. H. pylori is our proof. No acid means no pepsin, which means the collagen stays. Where is collagen? It's in the meat tissue, those white lines in the meat. If it's very thick, we call it gristle. Collagen needs pepsin, and pepsin needs the HCl that you blocked. That's why you have indigestion and primary level protein malabsorption. Because the meat reaches the next stage undigested. The glue we put in the food reaches the next stage undigested and sticks to the stomach wall. You have indigestion. The stomach is delayed. Food sits there with bacteria causing fermentation. This increases the reflux. When these patients get an endoscopy, they find mucosal breaks. The lining of the stomach is torn. So every time acid hits it, it burns. You take control lock. You take it again, and the process repeats. Every time you block HCl, you increase bacteria and fermentation. Your stomach stops being a meat grinder and turns into a water skin, leather bag, a bag of water where protein accumulates. The protein ferments with the carbohydrates, starches. You stay at home complaining of bloating, gas, and belching. Indigestion makes you feel heavy and tired after eating. Besides killing bacteria and activating pepsin, HCl is vital for something else. Iron cannot be absorbed without it. That's why you have acid reflux and iron deficiency anemia. It will never improve until you fix this acidity. So how did we treat reflux? What advice were we given? The doctor says, avoid fried food, heavy sauces, spices, mint, and black pepper. Don't eat 4 hours before bed. No. You were created to eat at any time and eat anything. Just stay away from what harms your stomach wall. Your stomach wall is like a drumhead. Thin, light, and stretched tight. It doesn't absorb anything. It just opens and closes. Look at the video. See how the stomach pushes food down to the duodenum. When you put a colloidal substance on that thin drumhead, it stops moving. The skin of the drum is stuck. 1, the contractions are no longer strong. 2, what happens when acid isn't produced? Bacteria increases, pepsin fails, and meat isn't digested. You get indigestion. You try to treat it with something that reduces acidity. You didn't treat it. In fact, you made matters worse. You just stopped the symptoms of reflux, but the reflux isn't cured. As we said, after you eat, the stomach tries to get rid of the food, but the white flour we ate is stuck to the stomach wall. It can't contract properly. The juices start rising. And if we look at the soup at the top, you'll find the garlic, the oil, the spices, the black pepper, the tomato sauce. You'll taste the garlic and onion in that soup, but the food causing the problem is settled at the bottom, stuck to the stomach wall. The stomach tries to get rid of it. It leaks past the safety valve, the lower esophageal sphincter. The water flows back. It has acid, but it's weak. But it's a sign that the stomach is suffering. The stomach is complaining. It's opening its mouth saying, save me. You must help it the right way. If you take antacids, you increase the indigestion. The soup is still there, but without the acidity, you don't feel it burning the esophagus, and it flows back. and you don't feel it. So the GERD or reflux is still happening, but you aren't feeling it. But you will feel the side effects and problems later. Look at this small bottle of slime. By the way, slime is made from refined white flour. Kids play with it. Notice that only the thin liquid comes off the top of the slime. But because it's viscous, colloidal, and sticky, full of glue-like gluten, it sticks to the stomach wall. It doesn't want to come back up. What rises is its soup with weak acid, causing reflux or irritating the end of your esophagus. It's telling you, I have a problem. The solution isn't to silence it with acid blockers. No. The problem is treated by solving the indigestion. And that's why with all our patients, the first thing I discuss is abstaining from all white flour products. Switch to whole grain flour in our food, our stomachs will rest. Within how long? Within 7 days, you won't need acid suppressing drugs again. I need that acidity. I need it to digest meat and proteins. I need it to kill the bacteria on my hands from being outside all day. Bacteria won't harm you if your stomach acidity is good. Iron, which only absorbs in the presence of acid, won't be absorbed, causing anemia that never heals. Doctors wonder why the patient isn't getting better even with iron injections. The solution starts here. You have a good stomach, you have a good life.